Hello everyone, my name is Dr. Joel Rosen. I am an adrenal fatigue recovery specialist, and I want to talk to you today about more than just changing your diet and going gluten-free and dairy-free in order to help your adrenal glands come back to life. I just had a consult with a patient today, and some of you may be able to relate to this. She owns her own fitness studio. She teaches probably 3 classes a day, and she is just exhausted. And so she came in today, and for all the hard work that she's putting in, she is eating gluten-free. She is only paleo. She doesn't eat hardly any grains. She eats very, very clean. And she's still suffering. And she knows that there has to be more going on than just the fact that it is a gluten or dairy problem. And she's absolutely right. There is more than just eating gluten and dairy that's going to cause a problem. Today I thought it'd be very, very informative to explain to you what some of those considerations are. So first thing I wanted to say was the blood tests. Blood tests are kind of like a pass and fail grade. It doesn't tell you anything about the quality of the grade. And so what I mean by that is, imagine I have twins and they're in school and they're getting a C plus on the grade. If they're getting a C plus, then obviously they're passing the grade, but they're not doing great. And so the traditional medical model would be, let's give you extra help once you fail. And when you fail, we can give you this drug or that drug, and then we can get you back into a healthy range. That's the equivalent to telling a kid, let's wait till you start getting Fs on this test, and then we'll start to give you some help until, let's not wait when you're at a C plus because you're doing normal. So I want to explain that to you. In this young lady's case, I'm not going to tell you her name, but in her case, and she said it was okay to share this information with my video, with my viewers, she did a complete blood count and her white blood cell range was 8.5. And on the lab test, it's going to look normal. It's going to look like 3.8 to 10.8. She's right in the middle. She's at 8.5. However, from a healthy range, it shouldn't be above an 8. So she's at 8.5. Think of a high white blood cell range as someone who has a new skirmish, and they are the first responders. Your white blood cells, whenever there's a new skirmish, they will increase or mobilize the troops in order to fight off an infection. It just so happened that her neutrophils, which it doesn't actually even say on this test what an actual a lab range is. So number one, not only is it so broad, but it actually doesn't even say anything on a functional range what it should be. Optimally, it should be anywhere between 40 to 60%, and she was at 73%. So she's 13% higher than what it should be, which confirms, again, some kind of acute infection, whether it be an H. pylori infection, could be another bacteria infection, but realize that her immune system, 80% of it is in the gut. And if she has inflammation in the gut, not only will that cause an immune response, that's going to cause an adrenal response. Why? Because there's inflammation and your adrenal glands are charged, or their job is to settle down inflammation. So if you have a bacteria infection and you're not able to absorb your nutrients, number one, your adrenal glands are called onto the scene and say, hey, adrenal glands, you got to go settle down the fire in your gut and secrete some cortisol to settle the inflammation. Also, you're not going to absorb proper nutrients like B vitamins, so you're not going to mature your red blood cells, and you could have a slight anemic tendency, in which she does. She has 12.9 on her hemoglobin, and from a lab test, it shouldn't be below 11.7. So she looks normal, but from a healthy range, it shouldn't be below 13.5. So she has some anemic tendency. So she really is a mess. She's not absorbing her nutrients. She's not maturing her red blood cells. She's not supplying enough oxygen to her bloodstream, into her cells, so her cells are fatiguing. She is not settling down inflammation properly because of the adrenal gland overuse, and she's fatigued and she's exhausted. So the trick is it doesn't matter how well she avoids gluten and dairy. The point is she's got a massive strain or drainer of her adrenal glands from the fact that she's not absorbing. And so what we need to do with her is we need to put her on some kind of gut repair protocol where we restore the normal flora, we re-inoculate with healthy bacteria, we repair the lining of the wall, and we remove any harmful pathogens. So that should make sense to you. But you know what? If you are practicing medicine from a point of view of an all or none, a pass or fail, then you're only going to get a C plus. Then you're not going to excel in this world of healthiness. So hopefully this made a lot of sense to you. It's not only about going gluten-free and dairy-free. It's about evaluating your blood work from a functional point of view. And from there, you'll be able to learn how it is to be healthy and to repair those adrenal glands. So again, my name is Dr. Joel Rosen. If you like what you heard, then just click on the link below and you can find out more information about what we do at the Adrenal Fatigue Society. And also, if you really like what you heard, please give a thumbs up or a like or a comment to this particular video. And I look forward to another edition of your Adrenal Fix. Thank you so much.